MSF has supported the Eastern Cape in all 3 COVID waves, and in the second and third wave has supported Livingstone Hospital, specifically in the basement COVID ward, which is actually a hospital car park turned into a COVID centre. There are 70 beds and piped oxygen, including provision for high-flow nasal oxygen, which has proved essential for the COVID response. So the infrastructure is there, but the problem has been staffing. During the second wave, MSF supplemented staffing in the basement, and further COVID beds were available at the Volkswagen Field Hospital. During the third wave, only the basement has been open. Department of Health has staffed this with nursing care to provide for 40 beds, however, only with 2 doctors, both of whom subsequently left for other posts. MSF provided additional doctors when the basement first opened, but from July, all of the doctors available have been from MSF. Some we've borrowed from other projects, some have been employed on short-term contracts. We've been supported by inspiring and committed senior specialists from internal medicine and ICU. However, they're also running departments on skeleton junior staff, and were not able to contribute doctors to work shifts in the basement. The hospital has not been able to support an adequate COVID response in the third wave. And because all of the beds in the COVID ward haven't opened, then patients are backed up in other wards, not all of which have oxygen, which is essential for COVID care. This third wave has been brutal and it's been prolonged. Nurses and doctors in the basement are run off their feet, rarely take breaks, and they're busy multitasking all day, providing medical care and support for critical patients. Mortality is high, and this is despite having advanced oxygen support. In the third wave, we've seen patients in their 30s and 40s who die from COVID. We've often had more than one family member admitted at once. Sometimes one has died, sometimes more than one. This is very hard, obviously, for families. It's also very difficult for staff. Our impression is that mortality is high at Livingstone because people know that the services are overloaded, so only the seriously ill are actually coming to hospital. This has been the reality of the third wave at Livingstone. MSF will continue to support response until well into September, because otherwise COVID services at Livingstone will totally collapse. But we need to recognise that MSF isn't a substitute for a functioning healthcare system. The hospital needs to be in a position where it can lead its own COVID response. And senior management in the Department of Health actually need to take charge of this and ensure that it happens. Finally, I'd like to acknowledge the hardworking and dedicated Department of Health nurses, physiotherapists and dietitians working in the very challenging and stressful environment at the basement COVID ward.